Part 1, Executive Summary. Let's begin by addressing the key questions we'll explore in this presentation. How do we navigate the industry's significant financial pressures while maintaining quality in healthcare delivery? We'll discuss strategies to manage these pressures, leveraging our strong budget performance, and draw on insights from our innovative budget evaluation pilot project. We'll also focus on maintaining consistency in leadership decisions and transparently addressing any ethical concerns, all with an eye towards ensuring fiscal responsibility and continued excellence. Part 2, Industry Context. Our industry is currently facing significant financial pressures, with a 200 basis point gap between reimbursement rates and cost inflation. This gap means our costs are rising 2% faster than the payments we receive for services, creating a strain that our organization must address. Broader challenges like rising insurance premiums and increasing medical costs further add to the complexity. Additionally, higher interest rates are expected to persist through 2024, which places additional pressure on our financial planning. Given those factors, it's essential that we approach budget cuts strategically, focusing on areas where the financial impact is most significant while preserving essential services. Part 3, why our department is already ahead. Our department has been proactive in addressing these challenges through an innovative pilot project. This project, developed in collaboration with the CEO, the CIO, and CFO, aimed to reduce expenditures with minimal impact on workforce size, defined as less than 5% of the required 25% reduction. Remarkably, the pilot achieved a 0% impact on workforce size for our department. Although we recognize that these results may not be replicable across the entire organization. Our success in running a 20% under budget over the past 2 years is a direct result of this pilot program's strategic planning, which has positioned our department as a leader in cost management within the organization. Software-related expenses are a significant part of our budget, typically accounting for 30 to 35% of the total IT budget. Managing these cuts effectively is crucial, especially given the operating expenses related to software, which can represent up to 20% of the IT budget. Our strategic approach has involved careful evaluation of capital projects, reducing the number of software vendors, and renegotiating contracts. Through these efforts, we've successfully reduced expenditures without impacting the size of the workforce, demonstrating the potential for scaling this strategy across departments. Part 5, Strategic Approach to Budget Cuts. When it comes to budget cuts, our primary focus is on minimizing the impact on patient care and essential services. While our pilot program successfully avoided impacting overhead, it's possible that after evaluating non-essential programs, a reduction in workforce size may occur. However, we are committed to ensuring that any such reductions will not affect clinical care. We'll use the Gartner Strategy Framework to define and track the success of these cuts, with a focus on establishing leading and lagging indicators to monitor and adjust our approach as needed. Mature leadership during a crisis requires a balanced approach that aligns budget decisions with organizational goals and the broader economic context. It's essential that we offer practical and collaborative solutions that can be implemented consistently across departments. By tracking and adjusting our strategies based on real-time data, we can ensure organizational agility. Effective communication planning is also critical. Ensuring alignment across the organization helps maintain consistency, transparency, and trust as we implement these strategies. Part 7, Communication Strategy, addressing the CEO situation. Dr. Kimball, we've worked together for many years. This strategy is provided without bias and is intended to demonstrate the values that have allowed this organization to thrive. Any concerns regarding the details or credibility of the allegations will be evaluated separately and are not part of the concern of those who are focusing on providing care to the patients we serve. This situation demonstrates the significance and value of allowing ethics, compliance, and the code of conduct to impact choices that enable us to fulfill our purpose of advancing the world of health. Therefore, in addressing this situation involving the office of the CEO, it's important to reinforce our commitment to the organization's code of conduct and ethical standards. Our company has a strict no retaliation policy for employees who raise concerns about ethics, compliance, and violations of the code of conduct. Collaborating with key leaders such as the VP of Communications, VP of Ethics and Compliance, and VP of HR, we could develop a unified message that ensures consistent communication across all departments. As we address the concerns of employees, we must do so with transparency and professionalism, maintaining productivity and morale within our teams. Part 8, Communication Strategy, Managing Budget Cuts. When communicating about budget cuts, transparency is key. We need to clearly explain the reasons behind the cuts, linking them to broader industry challenges like rising costs and interest rates. The proactive steps we've taken, such as our pilot project, have prepared us to navigate these challenges effectively. However, while the pilot program has been successful in reducing costs, it doesn't guarantee there will be no impact on staff. It's important to communicate this reality with empathy, ensuring that all staff are aware of the potential challenges ahead. Part 9, Leading Through Budget Cuts. As leaders, we must maintain regular communication with our teams throughout the budget review process. This means providing timely updates and being transparent about the potential impacts so employees can prepare accordingly. We should approach these discussions with empathy, acknowledging the concerns and anxieties of our employees. Whenever possible, the organization will first consider opportunities to repurpose associates into new roles before considering workforce reductions. By reassuring our teams and maintaining a focus on minimizing disruption to clinical care, we can guide our employees through this challenging period. Part 10, Innovative Leadership and Strategic Foresight. Our department's proactive approach is exemplified by the pilot project we implemented towards the end of the pandemic. This project developed in collaboration with the CEO, the CIO, and CFO was part of a strategic plan aimed at preparing for economic challenges, including rising interest rates. As visionary leaders, we understand the importance of not just reacting to immediate pressures, but focusing on future preparation. The success of the pilot project demonstrates that significant cost reductions can be achieved without compromising the quality of care or reducing workforce size. Part 11, Managing Emotions in a Crisis. During a crisis, it's crucial for leaders to level set emotions. Before engaging in discussions about potential ethical violations or budget impacts, we should first take the time to reflect on techniques for managing emotions effectively. Understanding how the brain responds to stress, particularly in high-pressure situations, allows us to better control our emotions and support our team members. By balancing empathy with rational decision-making, we can maintain stability and provide clear, thoughtful guidance to our teams. Part 12, Conclusion. To summarize, we've discussed the significant financial pressures facing our industry and how our department's strategic planning, including innovative pilot project, has successfully positioned us to navigate these challenges. Mature leadership in a crisis means making informed decisions, ensuring organizational alignment, and maintaining emotional stability. By focusing on strategic foresight, communications, and emotional intelligence, we can guide our department through the current challenges and ensure our continued success. The next steps involve finalizing our budget approach with the CEO's office and aligning our communication strategies to navigate this period with a focus on long-term stability and excellence. Part 13, Questions and Discussion. So I now invite any questions or discussions about the strategies we've covered today. Let's address any concerns and work together to ensure we fully prepare to move forward. Thank you.